In addition to regional anesthesia, vascular access, what else is an ultrasound device in the operating room for an anesthesiologist-rheumatologist?
Yes, well, if we look towards diagnostics, then here we are interested in the so-called urgent protocols, which allow a focal manner in the focus group of patients to assess a life-threatening condition. These are the conditions that, if we do not take some action now, may lead to the death of the patient or severe disability in the future. Yes, and therefore here we can talk about two, probably four directions that are suitable for intensive therapy of anesthesiology. This is primarily a protocol aimed at evaluating patients with polytrauma. This is a FAC protocol or accelerated ultrasound assessment of patients with trauma, which includes the diagnosis of latent blood loss, abdominal cavity, pelvic cavity, pleural cavities, tamponade, pneumothorax, what we can see, and what allows us to change the tactics of conducting. This will be very important in connection with the opening of new assistance complexes, which in Moscow are opening 6 emergency inpatient complexes in which patients with trauma will be admitted. And now there is a training of anesthesiologists, resuscitators, what exactly the ambulance doctors will do themselves, intensive ultrasound to assess the free fluid of the abdominal cavity, and this allows you to accept.
In the field of traumatology, right?
Well, yes, this is emergency surgery conditionally, yes, there may be a lot of additional damage, but globally it allows you to solve the issue in a certain situation. The patient goes to CT, for example, or to the operating room when we do not want to get the death of patients during computed tomography, and this is one of the scenarios decision-making. The next protocol, which is interesting primarily for the intensive care unit, is the RUSH protocol. This is a rapid ultrasound evaluation of patients with unclear shock and hypotension. That is, the patient was lying down, everything was fine, well, relatively speaking, it was of moderate severity, suddenly he deteriorated and the question arises, what is the reason?
That is, directly on the operating table.
It can be an operating room, it can be intensive care, it can be in the department. That is, he was transferred from the intensive care unit, he deteriorated, that's it. And here, if from the point of view of the educational trajectory, that is, doctors must pass the FAS protocol, and then after it go to RUSH. RUSH protocol, the FAST itself is included, because, well, one of the reasons for such an emergency is hidden bleeding. It can be. But here the RUSH is also expanded due to the focal assessment of the heart, when the intensive care doctor himself looks at the heart. And, in principle, it is quite easy to get the skills that visualizes the heart in prostrate positions and so on in classical ones. Plus, we look at an aneurysm, the presence of an aneurysm in abdominal aorta, we look at veins for the presence of thrombosis. And from these several complexes, we can identify the type of shock that the patient has, thereby quickly changing tactics and resolving the issue with some kind of intervention related to drainage or surgical intervention. Therefore, this is also relevant. And then the next stage of development may be the evaluation of the focal echo, that is, a more advanced approach for evaluating some assessment of the state of the right and left parts of the heart. It's important how quickly to do this in order to understand the cause of the right and left stomach and insufficiency, for example. A separate direction, which is one of the most interesting, which was developed precisely after the COVID-19 pandemic, is precisely lung ultrasound. Before the coronavirus, the story of the coronavirus, ultrasound of the lungs occupied such a small niche, well, let's say, for some experts who found a place of application. Well, we did, of course, on pneumotors, because it's important. It is precisely this pandemic that has shown how important it is when there are a lot of places in the world where there is no computed tomography and no X-ray, but there is ultrasound, and you can use ultrasound to assess the condition of the lungs, namely the pleural zones, but we, as it turned out, get damage to the pleural zones, which are already spreading further along the lungs. And here ultrasound is indispensable, because there are protocols for evaluating patients. And this is the node of the lungs, it has advanced significantly during this time. Therefore, most manufacturers are already implementing presets with their lungs, and that's where we need, for example, pure ultrasound without additional settings, so that it is clean at all, without any filters, because all ultrasound of the lungs are ultrasound artifacts. That is, we look at the artifacts and draw conclusions. Here on the border of the fabric of the air conditionally. Here. Therefore, these are 4 diagnostic areas that I would like to voice, and they are important. This is what happens if you possess these skills, then most likely you will have practically no incomprehensible patients. Well, that is, you can always build some kind of diagnostics and change tactics.